for the folks that are going to be presenting for us today. And I'm really excited about this presentation because, you know, it really allows us to get a chance to look at how folks are using the REAIM framework in really practical ways and with community programs that are going on. And so, like I said, very excited about this presentation we have today. And so let me do an introduction for you. We're going to hear from two people, Kylie Gallington and Emily Altman. And Kylie is a program evaluator for Alameda County Community Food Bank. And she's currently working on her Master's of Public Health degree at the University of California, Berkeley. She was employed previously at the Food Bank of Santa Barbara County, where she helped to adapt and implement the REAIM evaluation framework to be used in food security programs. So she worked in partnership with Emily Altman, who's also going to be doing the presentation today. And Emily is a Child Hunger Corps member of Feeding America, and she's finishing up her 2-year service term at the Food Bank of Santa Barbara County. And she's right now, as you might not be surprised to know, is evaluating food security and nutrition programs using the REAIM framework. Emily will pursue a master's degree in public health at the University of California, Berkeley later this fall. So excited to hear from these two folks. And at this point, I'm going to mute and ask everybody else to make sure that they keep their lines muted while Kylie and Emily give our talk. And once they're finished, we'll do our usual moderated questions. So if you have questions along the way, feel free to type them into the chat box, and I'll monitor that as we go along and make sure that we get the questions out to Emily and Kylie. So without any further ado, I will turn the time over to our guests.
All right, thank you so much, Paul, for that great introduction. So today we are presenting a REAIM evaluation of food security programs. And again, I'm Kylie Gallington, and I'm presenting today in collaboration with Emily Altman. So our objectives today, Emily, can you flip to that? Thank you. Our objectives today are twofold. First, I'm going to begin by discussing what led the Food Bank of Santa Barbara County to adopt REAIM evaluation. And for those who aren't familiar with food banks, I'll give a brief background before discussing how we actually adapted REAIM. And then I'll be turning it over for part 2 to Emily Altman, who will talk about how the food bank is currently implementing REAIM at the food bank. And she'll discuss in more detail the metrics that we used and how they were scored, as well as the challenges that have come up along the way. So getting started, beginning with an overview of the food bank network. There are currently a little over 200 food banks across the country, shown on the map, that are part of the Feeding America network of food banks. And Feeding America, for those who aren't familiar, essentially acts as a national umbrella organization to help ensure that food banks hold to the same standards and works and helps to make sure that
I'm sorry for interrupting. Can the folks that have just joined, I think, Daniel, if you can put yourself on mute, that would be great.
Okay, great. Thank you, Paul. And so for those who may not be familiar with food banks are essentially nonprofit organizations with the goal of ending hunger in the United States that provide food, education, and other resources to a network of hunger relief charities and to their community directly. Generally, food banks don't actually provide food directly to the public, but actually rely on a network of nonprofit partners to distribute food to clients through soup kitchens or pantry programs. But some food banks also have direct service programs. So for example, in this presentation, we'll be talking about how we used REAIM to evaluate the USDA's Summer Food Service Program, which the food bank hosts every summer to provide free lunches to low-income children when school is out of session. So as we've mentioned, we did our work with REAIM, specifically with the Food Bank of Santa Barbara County, which is located in Southern California. And the Food Bank of Santa Barbara County, which I'll just refer to as the food bank in this presentation, is unique in having several extensive direct service programs, such as the summer food service program that I just mentioned, that provide food, education, and additional resources directly to clients. And the food bank's mission is also unique in not just ending hunger, but also supporting and promoting the health of low-income individuals. And this shift in focus at the food bank is actually part of a nationwide trend to shift the mission of our work from just solving hunger to instead promoting optimal health among food insecure individuals. Emily, could you switch to the next slide? Thank you. So similarly, with regard to evaluation, there's also a trend to move from just looking at outputs to instead measuring outcomes. So the example that we use in the food bank world, historically, we've looked at the pounds of food that we distribute and the total people that we serve as our primary measures of success. But these are just outputs, and instead, we're now beginning to explore ways of assessing outcomes, such as behavior change and health outcomes among clients. And we also know that this trend is not just limited to food banks, but there seems to be a push among the nonprofit sector at large to begin evaluating outcome metrics. And funders in particular have been great in pushing for this trend for better data as a way of demonstrating how their dollars are being spent. So focusing on the need for evaluation at the food bank, there were multiple reasons to begin collecting better data. Both internally and externally, we wanted a better model for illustrating the overall impact of our work. Externally, we needed data to justify our work, especially to funders. And internally, we needed better data to help drive our decision making. So in my role at the food bank, I was a program manager, and in particular, I needed better outcome data to help assess the need in our community, to target areas for improvement among our programs, and also to help plan strategically, whether that might be expanding our high-performing programs or even scaling back on our low-performing programs. But we needed to start somewhere. So next, I wanted to discuss the limitations within the food bank that we needed to address before we could begin evaluating our work. And historically, our client data collection had been very minimal. Often food banks are serving individuals who may not have access to government assistance or other programs. And so traditionally we collect minimal demographic information from our clients on a regular basis. So to begin actually assessing outcomes would require a shift in how we interact with our clients. We also faced unique challenges in conducting client surveys. A lot of our low-income clients have low literacy levels and may not be able to speak or read English, especially in the Santa Barbara area. A lot of our clients were Spanish-speaking only, so there's the need to translate survey tools in a way that they can be interpreted by clients. And additionally, the program environment is not necessarily conducive to conducting surveys. It tends to be a rushed environment. For example, there might be a long line of clients that are waiting to receive food, and they're in a hurry to get through the line and get back home. So there's not a great environment for us to actually conduct surveys. And then additionally, for programs that address youth in particular, which is a big focus of the food bank, we may not actually have any interaction with parents or guardians. So actually, we needed to find ways to survey youth directly about their food security status. And then finally, the outcomes that we were interested in measuring are complex. For example, behavior change, health outcomes, and change in food security status are all complex issues with many possible causes and impacting factors. And we recognize that our programs may have a limited role in achieving any sort of impact in these areas. So we needed an evaluation framework that could look at process outcomes and really focus on indicators. So with all those limitations in mind, we began researching possible evaluation models that would fit our unique needs. And in our search, we came across REAIME. which appealed to us for a number of reasons. First off, REAIM is a comprehensive approach to evaluation that looks at process outcomes, which are a little bit easier for us to assess. And it's not only helpful for sharing our work externally, but also for helping us internally with our decision making. Another reason that REAIM appealed to us as well is with our focus on client health outcomes, it really appealed to us as a public health evaluation framework. So shifting gears, I want to provide an overview of how we adapted REAIM. And this slide is a little overwhelming, so I apologize. I know it's really small font. But we adapted REAIM to a scorecard model, which is shown on this slide, in order to easily evaluate the strengths and weaknesses of a program in more of a report card style. So every domain is assessed and scored on a scale from 1 to 10. And later in this presentation, Emily's going to give much more detail on how we assess the scores for each domain. But I just wanted to give a quick overview and introduce this idea to explain why we adapted REAIM to fit this model. So first, just an overview of what you're looking at. In some cases, several metrics go into a given domain score, and we often have subscores for each domain that are averaged together. So for example, there are 2 different scores that go into evaluating our REACH domain. For each score, we have a specific metric that we're looking at and specific measurement tools for collecting that information. We also have a pre-identified time frame for when the information will be collected. And then we also have instructions for how to combine the sub-scored information into a final score for each domain. So each domain ultimately will receive a score from 1 to 10, and then we average those scores together to get an overall REAIM score for the program, which again will be on a scale from 1 to 10. For us, for the people that are running the program, the underlying data that feeds into this model is actually the most helpful for us to look at, but it's also extremely helpful to be able to summarize it at a scorecard level to easily see where our strengths and areas for improvement are within a given program. Another important note that I wanted to make is that we created the REAIM scorecard to be an objective framework so that the same goals are set for every program that we operate. And the reason for doing this is so that we can objectively compare a program against another program that we're operating. Whereas if we had individual frameworks for each program, it would be really easy for us to set easy goals for ourselves to meet and therefore achieve unrealistic scores for all of our programs. So this is incredibly helpful for us because we can then compare and contrast one program to another program, and we can even compare different program sites against each other to see which ones are operating the best and which ones need some more improvement. And just another note about scoring in particular, which Emily will go into more detail about soon. We were being asked what is a good score by our external stakeholders. And so we took a deeper look at the data and decided that a score of 7 for each domain would be our goal ultimately. So looking at the underlying data, we found that a score of 7 seemed to indicate that the program was at least moderately successful, though ultimately our goal is to get our score as close to 10 as possible. But using 7 as kind of a cutoff level, we can easily see which programs we need to focus more on and which ones are operating fairly successfully, though of course they'll still have some room for improvement. So this makes it really easy to present the information to the leadership in our organization as well as external stakeholders. And I did want to give an example of how we would go about sharing this data. So using the objective framework as we do, we can easily demonstrate the strengths and weaknesses of our given programs, and we can compare different programs against each other. So this is just a really easy example of how we might present this information to our board of directors or our executive team at the food bank, so that we can easily show how a given program is operating against another program, and specifically which domains are in need of greater improvement. So for example, we could see from this graph that program 1 has a really low implementation score, especially compared to programs 2 and 3. And so this would be something that we would want to look at a little bit more closely to figure out why that is and what we could do to bring that score up. There's another way that we might share this data, which is just looking at the overall REAIME score for a given program. And this is helpful just at the summary level to show which programs are operating the strongest and which ones are in the most need of improvement. So in this example as well, you can see program 1 is below a score of 7, which means it's not meeting our current goals. And so this would be a target for improvement, whereas program 2 seems to be operating very well. So one final note that I wanted to share is that before we actually went about implementing the REAIME model to evaluate all of the food bank's programs, we did conduct a pilot phase, which was extremely helpful for us. And during this pilot phase, we really evolved the model as well as tested our survey tools. And so it was a continuous improvement process of testing out different ways of measuring and then revising how we measured in order to make the most sense out of the data. And we did our pilot phase on the summer food service program that I've mentioned previously, which was a really great test model for us because the program operates over 3 months. So we were able to implement the model and get results really quickly. And that helped us essentially to revise the model and then so that we could then implement it for all of our food bank programs. And one last thing to mention is that this is a continuous area for improvement for us. We anticipate that we will continue to identify and troubleshoot ways that the model can be improved. And we know that as new indicators become available to us, or as we develop better survey tools, that we may have to evolve the model to suit those new ways of measuring. But so far, the model has been extremely helpful, especially as a communication tool with stakeholders, and also to help us drive our decision-making as program managers. So with that said, I would now like to turn the conversation over to Emily, who will be discussing in further detail how each domain was evaluated and scored, and what our primary challenges have been so far.
All right, thank you, Kylie, and hi, everybody. As Kylie just mentioned, now I'm going to walk through our specific REAIME model in a bit more detail. So please make a note of any question you have, and we will have time at the end to answer all of your questions. And also, just as a note, as I go through each of the domains, I'll first explain what we look at to quantify that domain, and then I'll present to you our specific evaluation tools and how we gather the information and plug those numbers into our scorecard. So starting with REACH, we first look at whether our program sites are located in accessible high-need areas. And to measure this, we developed what we call a need indicator assessment, as well as a map called the Guide to Nutrition Programs. We also determine whether our sites are spread throughout the food bank service area using what we call the spread score. And I'll present each of these to you in a moment, but I first want to make a note that since our program sites are generally open to the public, and we actually do not collect individual clients' information, we evaluate REACH based on the location of our sites, being in high-need areas or not, rather than based on individuals' income level or other such information. So to score REACH, this is our need indicator assessment, which we use to evaluate the first part of REACH. And we use it to look at each program site in order to determine whether it's located in a high-need area. So to do this, we both look at the distance to other comparable services, which you can see on the top there. And so for our example of the summer food service program, we will look at the distance from the program that we're evaluating to the next closest site. And then we also look at the poverty level of the surrounding area. So of course, sites that are in higher poverty areas are higher need, and sites that are farther away from other comparable sites are also higher need. So as you can see here, the higher numbers are higher need sites, with a score of 5 being the highest. So to score REACH, we simply determine a score from 1 to 5 for each program site, and then average those numbers together to get a final need indicator assessment score. So in order to get poverty level and look at the distance between sites, we use this map called the Guide to Nutrition Programs, which we created here at the food bank to show total population living in poverty at the census tract level broken into quartiles. And we have this data both for children and the overall population, as well as program and food distribution sites throughout the county. So this slide actually just shows a snapshot of the map, but in fact it's designed to be interactive. So you can zoom in, click on program sites, which are those blue and green dots, and gather information that you can see here in the pop-up window, such as the agency name, the distribution site address, the time and days of distribution, and other information like that. So in order to calculate the distance to comparable sites, you can see in the bottom left-hand corner, we're able to filter the sites so that we can choose to only see youth sites or pantry sites or any of the other categories. So for example, if we're looking at evaluating one of our pantry programs, we can simply uncheck all of the other boxes and filter those out so that we can only view pantry sites, and then use the map to zoom into the location that we're evaluating and find the distance to the closest site. And then, of course, to determine the level of poverty, we simply find the site that we're evaluating and determine which quartile of poverty the census tract falls, with darker colors indicating higher poverty areas. So as you can see, this map is very helpful, and we use it for numerous other purposes, but it's been proven to be extremely helpful in calculating REACH. So moving on to the second half of our REACH score, here is an example of our spread score. It's really a simple calculation based on the % of target areas reached by the program. So during the food bank's strategic planning, we determined the 6 areas of the county where we should focus our resources. And these 6 areas are based on an array of factors, including food security levels, availability of resources, whether the sites are urban or rural, and the prevalence of other partner nonprofits. So to calculate this score, we simply determine the areas our program reaches and get a percentage. So here you can see the % spread is 67. So in order to plug this into our scorecard, we simply put that 67% on a scale from 1 to 10, which gives us a score of 6.7. So you can see on this scorecard, once we get our 2 REACH scores, we simply plug in the numbers to the raw success score column, which gives us an overall domain success score by averaging the 2 together. And I do just want to make a note that as we go through this scorecard, we set everything on a scale of 1 to 10 in that raw success scores column, so percentages are on a scale of 1 to 10. So moving on to effectiveness, to calculate effectiveness, we try to determine how well we're achieving our predetermined outcomes using tools such as surveys, interviews, nutritional analyses, and sometimes some other metrics. So similar to REACH, our effectiveness domain is broken into 2 sections, the first of which, and really the main section, looks at the overall goals and objectives of the program, which we outline in our program logic models beforehand. Since we are a food bank trying to improve food security, our main outcomes are mostly some indication of improved food security and satisfaction with our programs. So to measure this part of effectiveness, we primarily use client surveys that ask an array of questions, with some questions directly targeting those outcomes of food security and satisfaction. And we do ask a number of questions, and they're all very helpful in program planning, but we do have some that are specifically targeted toward measuring the effectiveness domain. So here's an example of a survey that we used last year. And to calculate this effectiveness score, we simply take the percent of clients who report some indication of improved food security and the percent who report satisfaction with the program, and get an overall percentage that we then, of course, set on a scale from 1 to 10. The second part of our effectiveness domain looks at the nutritional quality of the food that we distribute. Foods to Encourage is a simple assessment tool that's used by Feeding America to judge whether or not a food is healthy. This is based on a number of factors, including sodium, fat, sugar content, whole grains, and other such factors. And I will make a note that as a food bank, we are, of course, devoted to improving food security, but at the same time, we want to help improve the health of our county. So we make sure to account for nutritional quality of the food that we distribute as we evaluate our programs, which is why we include this part of effectiveness. So to calculate this, we work with a registered dietitian on staff to calculate the percent of food that we distribute that's considered foods to encourage. So for our summer lunch program, which is our example today, our RD calculates the foods to encourage percent of each meal we serve, and then at the end of the summer, we calculate out to get a final percentage. And then we set this on a scale from 1 to 10 and plug this into our spreadsheet. As you can see here, we scored really high for the first part of effectiveness, which is wonderful, but we weight that first effectiveness 1 score a bit more heavily because those surveys cover multiple outcomes, whereas Foods to Encourage really only covers 1. But we average those together and get a score, a final domain success score. So moving on to adoption. For this domain, we actually took the calculation directly from what Virginia Tech recommends. So of the total sites that are eligible to run the program, we determine how many successfully adopt and operate it. You can see here, there are those total sites that are eligible. So for our example today, those would be children's sites during the summer for our summer lunch program. But based on the food bank's capacity, the capacity of those program sites, as well as the location of those sites and a number of other factors, we only contact a certain number to participate. And of those, there are a total number that agree and actually successfully follow through and operate the program. So we simply calculate the percent of successful sites out of those that we contacted to participate and started working with, which we then set on a scale from 1 to 10 and plug it into our scorecard, which you can see here. For implementation, we consider the standards for program compliance, site satisfaction, and volunteer satisfaction. And similar to reach and effectiveness, we divide our implementation domain into 2 categories. So first, we are looking at compliance. And so in order to measure this, we conduct site visits and assign a compliance score to each of our sites based on our site visit form, which you can see part of on this slide. And this form takes into consideration all of the rules of our programs, which sites must follow in order to successfully operate the program. So as we were piloting this, we determined that non-compliant sites are those that break 3 or more minor compliance issues, or those that break 1 or more major compliance issues. And of course, these vary by program, but are all predetermined by the food bank. So as any compliance issues pop up, we obviously work with sites to help fix issues. So these compliance visits are not only helpful for REAIM, but also for our overall program coordination and ensuring that program sites are actually following through with what they agree to do. So to get a final score for this part of implementation, we simply calculate the percent of sites that are fully compliant and, of course, set that number on a scale from 1 to 10. So for the second part of implementation, we look at overall site and volunteer satisfaction, which we measure using surveys. And these surveys ask a variety of questions that all help us understand and improve our programs. But we have one question in particular that you can see here that simply asks how satisfied people are with the food bank support, with their role in the program, and the program as a whole. And we use this question specifically to calculate percent satisfaction, which we can plug into our scorecard to get a final implementation score. And we do average these two parts together equally. So lastly, for maintenance, we look at our reliable and sustainable partnerships from year to year based on 3 categories, which are financial, contract service, and in-kind partnerships. In order to calculate and score maintenance, we simply look at the percent of partnerships that continue from year to year within each of these categories. Since the food bank relies on partners to successfully operate our programs, looking at continuing partnerships is really the best way for us to determine the sustainability of our work. So we use this maintenance score assessment spreadsheet that you see here in order to write in all the specific partners, from the grants that we receive to the individual volunteers that actually operate our programs, both for the current and previous years, to determine what percent continue from year to year. And then, like every other domain, we plug in that number into our scorecard. And so now you can see this finished scorecard with all of the domains evaluated. And it's really helpful here to allow us to look at each of the domains' final success score, but also those raw success scores, and see which are high and which are low to determine where we're successful and where there are areas for improvement. So this level data is very helpful for us, but we can also compile the data into higher level summary, which you can see here. So once our entire framework is complete, we can see a final score for each domain, and then that final overall score that you can see here of 7.4. So these are the scores that we received for our summer food evaluation pilot last year. And this high-level summary is very helpful as we present to our leadership and board, and especially as we start to evaluate all our programs and gather final scores for all of our work. We'll be able to compare everything. But it also helps us see where we need to focus in the future. So you can see here we received a pretty low score for maintenance. And this is really helpful because now we're working on making sure we're sustaining our partnerships as we move into another year of the program, because those really are very integral to the success of this program. So this high-level summary is helpful, but we can always go back to the more detailed spreadsheet as we work with program staff to determine where we're successful and where we need to focus our work through the future. So moving on to the challenges, there were a number of challenges and limitations when it comes to evaluation, which we observed as we piloted and also now as we're using our REAIM framework for our other programs. First, we had to assess our resources to ensure that we had the staff time and resources to allocate toward evaluation. So both Kylie and I spent a good amount of time working on REAIM, but this we know is not necessarily something that other organizations and nonprofits are able to do, and it wasn't something that at the food bank we were able to do before Kylie and I came on. So that was a necessary first step before moving into this. Second, we are internal evaluators and obviously have a stake in the success of our programs. So we worked hard to keep our framework objective and unbiased. So Kylie mentioned before, but we use the same framework for all of our programs, and we have pretty strict guidelines for each domain. So we try to keep our own biases out, our own desire for high scores out of the process in order to keep our framework objective. We also had to understand our audience. So we've mentioned it a few times, but we present our highest level findings to our board, but when we meet with program staff who actually coordinate the programs, we're able to provide them with really detailed information down to the program site level. We're also working on establishing a baseline. Since we're just now coming out of the pilot phase and are in the process of evaluating all of our programs using this framework for the first time, we must establish this baseline so that in future years we can see growth and yearly improvements. But of course, this requires patience and time at the beginning to set up that baseline that we can compare from year to year. And lastly, while ReAIM brings in a lot of really valuable information, we work with people, and at the end of the day, their stories are equally important to us as the data. So we work to supplement these data with stories and other qualitative information, which is helpful to validate our work and also as we present to donors, our board, and other stakeholders. So that is all we have for you. Thank you all for listening, and we're happy to answer any questions you might have.
All right, well, I'm applauding on behalf of everybody. That was really great, Kylie and Emily. Thank you for taking the time to put together such a nice slide presentation, as well as your descriptions through there were great. I'm going to open up the floor for questions. And in fact, I think let's try and see if people can just verbally say their questions. So if you're not asking a question, keep yourself on mute. If you are asking a question, go ahead and try. And if that doesn't work very well, then we can just have folks type the things into the chat box and just click on everyone so that everyone can see the questions that you might have. Okay, with that, I'm going to give the floor, open up the floor for folks, and I have a number of questions I wrote down too, so if no one jumps in, be careful, I'll start asking.
Kylie and Emily, this is Sally Beth. Can you hear me?
Yes, hi.
Hi, thank you for your presentation. I am very interested in, you were talking about how you presented your data to a variety of different stakeholders. And I was wondering if you could elaborate more on which dimensions they were most interested in, if you saw differences between your audiences.
Sure, this is Kylie speaking. I can go ahead and start that question off. I think overall, our first audience that we started presenting this information to was our board of directors. And this was the first time that they had been seeing any sort of higher level evaluation data coming in from food bank staff. So they were really excited for this information, and the most interest was definitely with the effectiveness domain. I think that that's probably a common thread, that people are interested to see, are we actually making a difference in the community or not? But they were also very interested in especially our maintenance domain, probably because it was our lowest score on our pilot phase. And that's because it really, especially in the nonprofit sector, I would say, sustainability is a very important component of programs and not necessarily something that we look at very much on a regular basis. So the maintenance domain as well was of great interest to them, and figuring out how we could improve our sustainability was one of the big topics that we spent time discussing.
Great question, Sally Beth. So, I have a related one that I'll jump onto as well. In terms of the challenges that you guys talked about, it seems like you went through a lot of work to try and present this organizationally. And as you went through that, how did you manage to kind of get to the place where the folks that were in the organizational decision-making positions were thinking that this was a good idea for you to do, this level of detailed evaluation?
Well, that's fairly easy for me to answer because I really was the primary decision maker there. So I was on board, and so we really didn't meet very much resistance. But I would say that we were unique in that our development department, the fundraising department, was really the major catalyst for us beginning to do this work. They were looking for better data to come in to prove how we were actually using our funding and demonstrate that we were making an impact. And so by the time that we actually got to the evaluation stage, it felt like it was overdue. And the whole organization seemed pretty excited and on board to start seeing these evaluation results.
Wow, great, thank you. Other questions?
A question and a comment. Can you hear me?
Yes.
This is Russ Glasgow. First of all, thank you so much. It's a really innovative application of REAIM. It's great to see the creativity that you had there, given some of the limitations of individual data and things. So I really like that. Just wanted to comment that I think your choice of the effectiveness measures was really nice, that where you had a measure that looked at the what I'd call the quality of the food as well there, or what we might call unanticipated consequences, instead of just always giving people more no matter what. I thought that was neat, and I think it'll be really neat to see this applied across programs and look at the variability across your programs.
Yeah, definitely. Thank you so much, Russ. And that's one great thing about the way that we set up the framework, is that there's the same goals for every program, despite what the unique quality of the program is or what the audience is. So it's very objective, and we can compare and contrast how we're doing in each area. And really with the effectiveness domain in particular, we identified what indicators we wanted to measure by actually coming up with logic models for our programs and seeing what made the most sense, what was the most essential to ensure that we were effective in what we were doing. And the nutritional quality of the food is really integral to what we're doing. So we knew that needed to be part of the consideration. If we're not distributing nutritious food, then there's no way that we're achieving our goal with those programs.
All right, so I'm going to ask another one, and please, people, feel free to jump in. Otherwise, I'll just keep jumping in with the list that I wrote out here as you were going through there. Kylie, I was really intrigued by where you set a level of, moderately successful programs as kind of that overall REAIM score of 7 or above. Have you thought at all about things that, in the world of implementation science, there is some energy around de-implementation. So have you thought through a little bit when you do get to this point and start to compare across programs, where a score might be where you start to consider maybe not quality improvement for that program, but actually de-implementation of that program?
Yeah, definitely. And I think that'll continue to be a conversation as we start evaluating more and more of the programs, which Emily is working on right now. So it'll be interesting to see how some of the programs compare. And we've had this conversation, especially our board of directors. They had that question as well of, when do you make the call that this program is just not effective? And we realized that we need to look at it more holistically. So it's possible that a program just inherently is not going to be strong in a given area. So for example, our summer food service program, our maintenance score was extremely low. And this was no surprise to us, because every year it's like pulling teeth trying to get that program up and going again, because it's a seasonal program. And so trying to maintain partnerships and relationships throughout the year is extremely difficult. And as a result, it's a program that doesn't feel very sustainable. It feels like it's a lot of work and resources that need to go into it every year. And ultimately, we as the program managers didn't have the power to decide whether to discontinue a program of that scale or not. But this evaluation data starts to at least get the conversation going. so we can start talking about, here are the resources that we're putting into this program, and our maintenance score is low, and we can do our best, but let's see if we can get our maintenance score up over the years. And if we can't, it might be more of a conversation to start having of whether or not we want to continue trying to make this program work when it's really not a sustainable program.
Yeah, I wonder in that case if, an idea for maybe an additional maintenance indicator would be that if you have a seasonal program, how many seasons has it been run for? Because it could be that it's a pain to keep volunteers engaged from year to year, but in fact, you end up being able to run it year to year. And so it might be sustainable based upon the process that you use to engage new volunteers on each year. And that, I don't know if you guys had thought about kind of using that for programs that maybe aren't continuous.
Yeah, and actually, when we originally set up the maintenance domain, we were just looking at how many years consecutively the program was operating. But by nature, it meant that our newer programs were scoring really low, and our older programs, just because, they'd been grandfathered in and had continued to go, they were having higher scores. So that's something that, we were still playing around with how we might still incorporate that piece. Maybe it's just a subscore of that domain. But the other thing that's helpful is we actually consider our volunteers as partners. So we actually measure volunteer turnover and take that into account as part of the maintenance score, which is really helpful because, volunteers, if they're coming back year after year, then we're definitely doing something right. But if we have to start fresh every year, then that's, a bad sign for the sustainability of the program.
Right. Very good, thank you. Okay, other questions from folks? I'm trying to use my community-based participatory research skills and wait for a certain period of time to let people respond, but I'm really not very good at that. I'm going to wait one more second. Anyone have another question before I jump in?
I have one question. Thank you so much for this presentation. It was very interesting and well put together. I was wondering about the timeline. How long did this pilot take? And from start to finish, I know it must be done in chunks, but how long did the overall project take to get this information together?
Emily, I'll also let you speak to this as well if you have a different thought on this, but I was there really from day one, although I was not originally heading up the project. So we did have a previous staff member who selected REAIM and created a draft of the framework. So I will say that we came into this project with that background already being completed. But that said, Emily and I, when we first started to work on the REAIM evaluation, essentially overhauled the entire model and made it an objective framework. We changed the domains. And so I believe that we started this work around March and then launched the Summer Food Service Program in June and completed the pilot phase of the evaluation in August. So it was, roughly about a 6-month period in total for the pilot phase to be completed. And we were heavily in the process of making decisions about scoring and creating the different measurement tools throughout the pilot phase. Emily, did you have any other thoughts to add on to that?
Yeah, I'll just, I agree with everything you just said, but I'll also add that as we were going through the pilot and even after, we've been testing all of our tools. And so they've kind of transformed a bit over the past 14 months or so that we've been working on this. So it's kind of everlasting, and we're hoping that what we have now will work. We're now using this framework for all of our programs. We have about 5 or 6 programs that we're using this for right now. And all of those evaluations will be finished in July, except for our summer program, which will be finished in August. So I anticipate that there will be some changes that might have to occur as we use this for across programs, because before it was really only for the 1. But I do agree that we had about 6 months for the pilot phase, and that was enough to get everything tested and rolling.
Thank you.
I'm waiting for questions.
Sorry,
Okay.
I want to add something to that. Sorry, this is Emily. I also do want to add that Kylie and I were not working on this full-time. We had other work to do. So I'm sure if we had been doing this full-time, it would have been faster than that.
Yeah, that is a great point, Emily. As I've mentioned, we were actually running these programs while we were evaluating them. So I would say that it was about equivalent to one full-time employee, with both of us working on the REAIM evaluation about half-time.
So I had another more specific question, I guess, related to the implementation evaluation piece. And you know, one of the things that I wanted to make comment before I ask my question is that, you know, I talked with Marcia Ori, who I don't think was able to join us today. And, you know, one of the things that we talked about related to the REAIM framework was kind of the importance of the principles that underlie that framework. And, you know, one of the things that I was really excited about as you talked through is that you guys came up with these objective indicators that you could make scores out of that really were kind of what, in my view, very consistent with what each of the dimensions was trying to capture. And so I wanted to congratulate you on that, because I think that's not an easy thing to do. And so yeah, I just really like that a lot. So the question that I have is one that I think is also really important for folks that are, you know, both research and practice folks, is this idea between major and minor compliance issues. You know, so you said you'd mark people on the compliance, and then you would deem whether it was a minor variation or a major variation. And just maybe if you could give us a little bit of some examples on how you made decisions on what was a major one and what was a minor one.
Yeah, definitely. And Emily can speak to how she's assessing that for the other programs. This is another reason why our summer food service program was really great as a pilot program, is actually the USDA makes those designations for us. So any major violation would be something that they would actually, if they were auditing, they would shut down the program if they saw it. And, you know, so it's, with it being a USDA program, there's very, very specific rules and regulations that have to be upheld at every program site to make sure that we are not, you know, putting any children at risk for food safety issues, and to make sure that, you know, civil rights are being upheld, that sort of thing. So major violations were certainly not something that we would expect to see at a program site. And in fact, if a major violation did occur, then we may very well close down the program site immediately, because, you know, we can't take on that sort of liability. But with our other programs that are not held to such strict federal regulations, we had to definitely make more of a designation as far as what would constitute a major violation versus a minor violation. So Emily, do you want to speak to that a little bit more for our other programs?
Yeah, absolutely. So we have the site compliance form that we use to visit sites, and we actually based it off of the USDA site visit form that we use for our summer program. So minor violations would be things like the delivery schedule isn't being followed, or the staffing or volunteer pattern is different, so different volunteers are present one day than we expected. But major compliance issues are going to be things around food safety, because at our core we're distributing food to people, and we need to make sure that the food that we're distributing is healthy. And also things like civil rights, so if the sites are discriminating against people. So we actually really do try to mirror the major compliance issues for all of our programs off of those compliance issues that the USDA outlines as major. Yeah, I hope that answers your question. But of course, this is something, as we're using this tool for all of our programs, it's kind of a learning process. But so far, it's been working out pretty well.
Great. Thanks very much, Emily. So it looks to me like we are rounding out our hour. And so, again, I wanted to thank everyone for joining us, and thank Kylie and Emily for giving us a great presentation today and answering all of our questions for us. We will be posting this up on the website so that others can enjoy it in the future. Definitely a lot of great things to learn from what you all have done there. So thanks again very much for joining us and for giving us such a great talk today.
All right, thank you so much.
Okay. All right, everybody, have a great day, and we will talk to people soon. So long. All right, Andre, I guess we can stop the recording.